Welcome back. We are joined now by Dr. John Rodriguez. He is Chief Medical Officer at Healthcare to You. He is passionate about the care that is provided to their patients, and he manages all the care providers in Healthcare to You's network of clinic and oversees care protocols and training. And what we're going to talk about today are we sabotaging our sleep? 8 sleep hygiene rules. Dr. Rodriguez, how are you this morning?
Yes, well, Mr. Kennedy, thanks for the opportunity.
Well, thank you very much. I appreciate you coming on. I'm one of those people who sabotages their sleep all the time. I'm one of those 5 hour a night guys, and I know I need more. So, whatever you say in this conversation, you're going to be speaking directly to me.
Yeah. Well, very good. I mean, obviously, in private practice in times past, this is a common problem. And the irony is that I wouldn't see people for chronic insomnia. I would see them for medical illnesses that were related or due to chronic insomnia. So whether it's type 2 diabetes, hypertension, depression, fatigue, anxiety, all sorts of immune function issues, when I come back and ask the patient, well, how's your sleep? And the majority of these patients, the sleep is terrible. And so that's what we're trying to prevent. If we can keep someone on a regular good sleep cycle, I think it's going to avoid a lot of problems in the future.
Okay, I noticed. I'm sorry. A couple of notes. The Oxford English Dictionary defines good sleep hygiene as habits and practices that are conducive to sleeping well on a regular basis. And poor sleep hygiene, which can eventually lead to chronic insomnia, can end up causing a multitude of health problems. So let's start with maybe the insomnia issue. I know a lot of people who, they say it like this: my mind just doesn't shut off. They just can't stop thinking throughout the night. Fortunately, I don't have that problem. Once I'm in bed, I'm out like a light. But I know a lot of people who really do struggle in this way. And my producer, Enrique Garcia, he's pointing at himself like he has that problem. So what can they do?
Yeah, so that's a common occurrence, right? Chronic stress and worry and all these things. Obviously, we all deal with that. And the majority of us can take it and do well with it. We still get our sleep. We still get the sleep we need, but a lot of us have trouble dealing with that. So there's a couple of tricks, I think, and kind of a little list of things I tell my patients. And really the first thing is just remember nighttime is for sleeping, right? So a lot of patients think, well, I get my best work done in the middle of the night from 12 to 3 and things like that. And they may think they're doing themselves well, but it's really the worst thing you can do is that nighttime is for sleeping. Daytime is for wakeness, and nighttime is for sleeping. So that's number one rule. Get on a regular sleep cycle. Number two is obviously before bed, you want to avoid anything that's going to stimulate the brain and stimulate you, which is caffeinated drinks. I mean, it sounds kind of silly, but I know lots of people who just tend to drink their Cokes and their coffees and things like that. Believe it or not, after 6 p.m. thinking that they're just getting a good energy boost, but just be careful there. That's number two. And keeping a regular sleep routine. People think I go to bed one day 10 o'clock, and next day I'm in bed by 1 in the morning, etc. I think the consistency of your sleep routine is critical, right? You want to, as best you can, go to bed at a good time and wake up at a good time. So we know we have our nights where we're up half the night for whatever reason, but that being said, the routine is important. Avoiding large meals prior to bedtime, believe it or not, that tends to cause problems. So 3 to 4 hours prior to bed, try and avoid anything large. These things tend to cause gastrointestinal problems, cause cardiac issues, believe it or not, palpitations, things like that, things that tend to create more stress and worry when you're laying there thinking about your heart because it's kind of pounding away because you've got all this food in there. So those are important things. And then the acid reflux that tends to come along with that. So
you bet.
And then you're...
Well, Dr. Rodriguez, and I do want to get to the rest of the list, but I want to jump on a couple of these. Dr. John Rodriguez, Chief Medical Officer, Healthcare to You. So let's start with number one. Nighttime is for sleeping. What about those people who work all night?
Yeah, that's a tough. The night shift that we call night shift work sleep habits. The nurses, the ICU attendants, etc., that do work after hours. It's a special crowd. They really enjoy that. For them, that's good. And there are a few select people that can do well with that. Most of us have a hard time with it. It's just that night shift work does create circadian rhythm issues with sleep. And so daytime tends not to allow us to get the deep sleep we need. So we have to be really careful. I tell my patients, if you can avoid that at all costs, please do, because that's just, granted, you may make more money, but at the end, it's not worth it. So just be careful there.
I saw something interesting here, that daytime hours in sunlight are important for the production of serotonin, a brain hormone responsible for well-being. So is it common then that people who tend to work those night shifts because they have to sleep during the day, that they're more prone to, depression and chronic fatigue?
That's exactly right. So that's a common occurrence, and frankly, during the winter months, we tend to call this condition the seasonal affective disorder condition, which leads to stress and depression and all sorts of maladies, and that's because of the issue that daytime and sunlight is required for serotonin brain hormone levels, and we need that. Serotonin is a relaxer. It makes us feel good. And so if we don't have that built up in our brains, we're not going to feel good. And that tends to follow the case when we have patients who do work nights and don't get the serotonin and the sunlight that they need. So that's critical to know that. So.
Interesting. We were talking about regular sleep routine. Try to go to bed and wake up around the same time most days, and then getting enough sleep. And I mentioned that to you, and I simply don't get that, that 7 to 8 hours, and it doesn't even seem possible. And so, but I like to say, and you probably hear this all the time, Dr. Rodriguez, I really don't require as much sleep as most people. That's probably not true, right?
Yeah, that's not true. That being said, I think the quality is critical here. If you can only get 5 hours every so often, I think the key is the quality of that sleep. If it's good quality sleep, restorative sleep, that's, I think, half the battle. So the days you can only get 5 hours, which again happens to many of us, all of us. Some days we just don't get the sleep we need in terms of the duration, but the quality is critical. So that's, I think, the take-home point there.
I want to go back to eating a large meal before bedtime. Another thing that I hear commonly, Dr. Rodriguez, for those people who do have somewhat irregular hours, we'd all like to work an 8 to 5 and get off, get home, have a little bit of wind down time before dinner, and then take the dog for a walk afterwards. But for those people who are on much tighter schedules than that, eating quickly and going to bed may just be part of their reality. What changes need to be made there? Because people are hungry. They get home, and so obviously a significant change needs to be made there.
Yeah, a couple of tidbits. One, I agree with you. There are situations where you just, you're tired, you just ate, and you want to go to bed. I think the key is the type of meal you eat before bedtime, trying to stay away from carbohydrates. Any sugary, starchy foods, if you can avoid those, like pastas and breads, etc., that would make your night a little easier if you avoid those sorts of food types. More proteins and green vegetables tend to sit well and sit better in the stomach if you have to go to bed quickly. So that's, I think, an important take-home point.
You just took like cake and ice cream right off the. You made a lot of people mad at you right now. Okay,
that's right. Those food items tend to cause a lot more problems, gastrointestinal problems, right before bedtime. So just to let you know.
A list of symptoms typically associated with insomnia, and I think this is important information to get out there because for those people who do have the sleep disorder, that have trouble sleeping at night, type 2 diabetes, heart disease and hypertension, obesity, and we know that not getting enough sleep, your cortisone levels tend to go up, depression and anxiety. And then I was surprised by one of these, Dr. Rodriguez, and that's fibromyalgia. How does insomnia affect fibromyalgia?
Well, the interesting thing, there's a clear link between insomnia and chronic sleep disorders and fibromyalgia. We don't know exactly the pathophysiology, how they work together, but I can tell you historically when I see anyone in my office who comes in with a diagnosis of fibromyalgia, first thing I ask them is about their sleep, and by far all of them have a sleep disorder of some kind. And so I can't say how physiologically that link is there, but there's no question if we can prevent chronic insomnia, we will see a lot less fibromyalgia. And not only that, but the patients we do see with fibromyalgia, once we get them on a better sleep cycle, they do better. They have less pain, they have better function. They just feel better all around. So I think that's the take home there.
So, I'm just seeing, such a connection between good sleep and all of these different conditions. So poor immune function and frequent infections, would not have thought that one. Chronic fatigue, no surprise there.
Absolutely.
But in frequent infections, that surprises me a little bit too.
Yeah, Yeah, those being just the traditional head colds, upper respiratory infections, maybe pneumonias, et cetera, because there's no question that it's been proven that scientifically that the immune system is definitely coordinated by the sleep cycle. Better sleep cycle, sleep routine definitely leads to fewer infections. I mean, your common colds, things like that. I mean, there's no question that there's a clear link there. So, and again, just the overall health of the individual. Does that mean that we're going to see less, pneumonias and less COVID cases? Probably not. But I tell you, your everyday colds and respiratory infections can definitely be improved.
Dr. John Rodriguez, Chief Medical Officer at Healthcare to You. The question is, are we sabotaging our sleep? 8 sleep hygiene rules. Now, let's get a couple of these out, a couple others out here. Minimizing your fluid intake after 6 p.m. So obviously having to get up and use the restroom, that makes sense to me.
Yeah. Yep.
And how about the over-the-counter meds?
The things we don't think about, right? Your cough, cold meds, a lot of those are stimulants. So you have to be really careful. Just read the instructions on how to take the medicine. A lot of them do say avoid before bedtime. So those tend to be stimulants, decongestants, etc. So just be leery of that, and always read the products you're buying that you don't want to take before bedtime.
And then the other one here. Now this, I'm gonna get at you a little bit here, Dr. Rodriguez. 1 hour prior to bed should be winding down time. That's a cute story for a non-busy person. Okay, but for that person who's doing laundry and cleaning up the kitchen and doing every other activity that they need to do before they go to bed, because what keeps them up at night is not having everything done. So that sounds really cute and everything, but that's not reality for some people.
Yeah, I think, again, in this case, time management is critical. Obviously, you need to manage your time. I know a lot of us get into the day without having a schedule, right? We just know we've got to do things and don't really know and then how to do it. But I think time management is critical in that, so if you can get a lot of that work done as soon as possible prior to bedtime, and just spend at least 3 minutes of relaxing. Don't turn the TV on, no social media, no phone. Just get a good book, good magazine, some prayer time, sit back, just relax. And I think that's critical in just getting you into that mood. So.
Well, Dr. Rodriguez, I appreciate the time this morning. So here, and these are all great suggestions, and we are going to embrace them and promote them. But you do realize that you made probably half of my listeners upset at you this morning because you took ice cream and cake away from them, and you suggested that they manage their time a little bit better and stop doing laundry and cleaning right before bed.
That's correct.
No, seriously though, when you have people in your office, and these are very real situations for them, and I'm sure that you've had a number of them look right across the room at you and go, "Yeah, but it sounds good, but how? That's not my life," And the comfort of having that small bowl of ice cream, and the burdens of their life at home just dictates that they're not able to get that 30-minute wind down period. Is there something else that because getting 6 of the 8 things on the list is still good, right?
Mm-hmm. Yeah, the majority by far. And I think the key here is that you need to strive for the good sleep. If people don't pay attention to their sleep and are used to it, which is chronic insomnia, then you're headed for trouble. So I think to recognize the fact that my sleep is disordered, although this is the way I've lived for weeks or months or years, they need to fix that. That's number one, just to understand that that's important. They may be used to it, but they need to fix it. Number 2, your primary care provider is critical, I think, in this piece, is that they can help walk you through that. And if medication is necessary, just temporarily, I don't believe in sleeping pills per se, but there are agents out there that can definitely redirect your sleep cycle and get you back in the normal routine if you want it. And that's the critical part here, is that if you want this. And that's what I'm trying to make patients aware of, that you need to be realized that this is an important aspect of your health. So speak to your primary care provider and see if they can get you on a routine of normal sleep again.
Bottom line, take responsibility for your personal health, and we
That's
appreciate it. The last thing on the list of some of the chronic problems, and I saved this one for last, but shorter life expectancy. I think in most cases, if you tell a person, hey, listen, you're going to need to change your habits, or you're cutting your life short, or that oftentimes is how change takes place. So maybe we should start there, huh?
I agree. Yeah, and I just simply put, if you just think about it, if you don't get good sleep, you're not well rested, you're going to be tired. And you're going to be tired, which means that you're not going to exercise, which means that you're not going to watch your food intake very well, because the fatigue trumps everything, right? And so your ability to exercise and take care of yourself is not there, which means that here comes the weight gain, here comes the diabetes, here comes the heart disease. It all kind of fits if you think about it. So,
hey, Dr. Rodriguez, before I let you go, how are you with your own advice? Do you do pretty well?
Absolutely. I think that one of the important messages here is that if you see that you're falling into this trap of insomnia, you need to jump on it right away and deal with it. And that's what I do. When I see I have a bad night, the next night, all right, I'm not going to let that happen again. So I take over-the-counter melatonin, for instance. It's a good little sleep agent to redirect my sleep again and get me back in a normal routine. So absolutely, that's critical to me. It's very important to my family as well. I tell my kids that making sure that they're sleeping well.
Fantastic. Dr. Rodriguez, thank you so much for your time. I really appreciate it. I'm going to reach out to you again sometime in the future. Actually, once I have improved my sleep habits, okay? So,
there you go. You'll feel better.
Absolutely. Dr. John Rodriguez, Chief Medical Officer at Healthcare to You. We're going to step aside. We'll be back. This is The Legend, 93.5 AM 930.